right about now, a lot of folks on Medicare Advantage plans are stressed out and they are freaking out for a multitude of reasons because this past fall, between October 15th and December 7th, that's your time to make changes. And for a lot of folks, they just assume their 2025 Advantage plan would be similar, almost identical, and it would roll into 2026. So now January arrives. Suddenly, many folks feel trapped. They feel like they're being held hostage. Why? Maybe your doctor recently stopped taking the plan that you're on. Maybe your drug costs with this new plan have doubled. You assumed that the plan that you had in 2025 would be similar to 2026, and it's not at all. Or your plan exited the service area, so you had to find a new plan. Come to find out, the hospital that you love, MUSC, does not take the insurance that you took. For instance, Humana. They don't take Humana. Or a lot of specialists in our area are dropping. They're just dropping United Healthcare, Humana, even Aetna. They want nothing to do with these Advantage plans. But the biggest reason folks are panicking is because that PPO plan they had last year turned into an HMO plan or an HMO point of service. Same thing. You really can't go out of network. And if you did, you'd pay 40% of whatever the cost is. So, and in addition to that, doctors this year, they finally put their foot down. They're saying, we're not taking your HMO. We don't want the low reimbursements that you give us. We don't want the administrative burdens that we have to put and hire new people to deal with prior authorizations, routine denials for things that are normal, that original Medicare would always cover and never deny. Hey, this is Chris Dewey from May River Medicare. If you find value in some of these educational Medicare videos, click the link above, subscribe. There's more on the way. We are advocates who educate, empower, and enroll. Now on to what we can do. Let's talk about the Medicare do-over period. So what do? You're stuck. You're held hostage by a Advantage plan that's not working for you. Can you just serve up divorce papers to your Medicare Advantage plan and say, I'm done with you? I'm moving on. I found somebody better. Actually, yes, you can, but most folks don't realize this. All right, if your Advantage plan isn't working for you, take a deep breath, relax, because Medicare has a do-over period. But this do-over period is only for folks that are on a Medicare Advantage plan. That's why they call it the Medicare Advantage Open Enrollment Period. It runs from January 1st to March 31st. You can only make one last change, and you're locked in for the year, so you better make it count. You can either change from one Advantage plan to another different Advantage plan. If you change in January, it'll start February 1st. If you change in February, it'll start March 1st. If you change in March, it'll start April 1st. You make one change. You can also go from Medicare Advantage back to original Medicare. How do you do that? By enrolling in a standalone drug plan, a Part D drug plan. When you enroll in that triggers the Center for Medicare Services to replace your Advantage plan with the drug plan. So it kicks that out. And then the first of the month, you have Part A, Part B, original Medicare, and you have your standalone Part D drug plan. All right? Because you can't have both. So just a reminder, if you have a Medicare supplement plan, you want to change from one Medicare supplement company to another, you just had a bunch of rate increases from AARP or Blue Cross, Omaha went up 20%, Aetna's gone up 19% this year. That adds up over a period of years. What you want to do is you can change your Medicare supplement to a different Medicare supplement any time of year you want. Medicare supplements are not governed by enrollment periods. You can switch in June, as long as you can pass underwriting. As long as you can answer yes to some health questions, you can change supplements anytime you want. So these enrollment periods are irrelevant. They have nothing to do with changing from like a Plan G to a Plan G supplement, or an N to an N, or just one carrier to a different carrier, or a Plan G to a Plan N within the same carrier. You're still going to have to pass underwriting, all right? But warning, if you've enrolled in a Medicare supplement Part D drug plan to kick that Advantage plan out before you have passed Medicare supplement underwriting, you could accidentally cancel that Advantage plan and then be denied the supplement. leaving you high and dry, forcing you to pay 20% of God only knows what. Outpatient surgery, hospital deductibles. There's no limit to what you can spend if you just have original Medicare. So instead, follow these 3 steps. Do not cancel your Medicare Advantage plan first. Apply for a Medicare plan, a Medicare supplement plan first, and wait for the approval. Only after your Medicare supplement plan has been issued or approved should you then enroll in your Part D standalone drug plan. So a quick review. The Medicare Advantage open enrollment period is only for folks who have a Medicare Advantage plan. They have to have an Advantage plan on January 1st. During the Medicare Advantage open enrollment period, you can switch from an Advantage plan to a different Advantage plan, or you can drop your Medicare Advantage plan and return to original Medicare Part A and B by enrolling in a standalone Part D drug plan. One last thing to consider. If you have a Medicare Advantage plan that's not working, you find one that looks good, it's got all your doctors and drugs in the formulary. If you enroll tomorrow, your new Advantage plan will start February 1st. Let's say in February, you decide, I just don't want Advantage plans. Half the doctors have left the network. I don't feel comfortable with denials and prior authorizations with these privately managed companies that have stockholders. If you switch to a standalone drug plan and get a supplement in February, that coverage will start March 1st. And if you change in March, your new coverage will start April 1st, okay? One last thing to consider, doctor networks. Providers are opting out of the networks. They're shrinking significantly in 2026. Many Advantage plans now include a smaller percentage of local doctors in the urban areas, as low as 18% of the doctors in metro areas. 1 in 7 U.S. doctors does not take Medicare Advantage plans. And this is reflecting broader trends of providers opting out of these networks over the last year. At least last year, 14 major healthcare systems have ended or limited Medicare Advantage contracts for 2026, meaning doctors affiliated with those systems like MUSC, they are no longer in network, and a lot of them just won't take the Advantage plans. Why are doctors leaving Medicare Advantage plans? Well, due to lower reimbursement schedules for the Advantage plans aren't paying them as much, especially with the HMOs. And another huge thing is the administrative burden of having to hire people to just do prior authorizations and appeals on denials all day. Just ask your doctor about it. They'll tell you. Talk to my allergist. He said he had to hire 2 full-time people just to deal with the administrative BS that these Advantage plans pile on them by letting artificial intelligence deny a claim. So just be aware of that, all right? And big news today, Donald Trump announced instead of the 4 to 6% Medicare Advantage increase that the government was going to give the Medicare Advantage, Trump just came out and said it's going to be looking more like less than 1%. So far less money than they anticipated for 2027. Today, Humana stock down 21%, ARP down 19%. And what's going to happen with less funding, I fear that these Advantage plans are going to lose more doctors. Restrictive networks are going to get more restrictive, less extra benefits, and these 1-0 premiums will have an average premium of $50, $60. Not too far below the plan and supplement, guys, so consider that. So consider changing your Advantage plan back to original Medicare, not an Advantage plan. All right, in conclusion, this is my recommendation. Use this do-over period to get out of your Medicare Advantage plan back to original Medicare. Why? Let's take a real-life example. This is a Medicare Advantage plan in Beaufort and Jasper County. It is a PPO. It's $29. It's got a nationwide enhanced network of doctors. It's the only true PPO we have in our area where there's co-pays for everything. Most PPOs, Blue Cross, a few of the other ones, Humana, you go on a network, you're going to pay 40% of God knows what. All right? That's a lot. That's 20% more than original Medicare. So you go to the doctors, it's $45. He says, hey, John, you need an MRI. Something just doesn't look right. So we get the MRI. That's another $300. Okay? After they look at the MRI, hey, you need total knee replacement surgery. And let's just be conservative here. you're overnight. You're at the hospital one day. That's $388. But of course, you've got physical therapy after that, right? And I'll just I know it's more than 1 month, just for easy math. What we're going to do is we're going to say you got to go to physical therapy 3 times a week for a month, all right? And what you're looking at with that is going to cost you $420 for the month. And when we add all that up, this plan does have a $29 premium. The good plans now, where you can go in and out of the network, at minimum, they're going to be $29 to $40, $60 a month, real PPOs. So now you got the $29 a month. That comes out to $348. I'm looking over at the screen. So your total annual cost is $1,500. Now, let's switch over. 70-year-old female. Plan N. Let's just go with the low one. Humana is a good supplement. All these supplements offer identical benefits and coverage. They're standardized by Medicare. So Humana, $82. So that's going to be a $996 annual premium. Plus, you got a Part B annual deductible of $283. All right. Your MRI with a Plan N after you hit the deductible is $0. Your hospital is $0. Your physical therapy is $0. All right. Let's say you go to a couple of doctor's visits. It's between 0 and 20 for Plan N. You can never pay more than 20. Average copay is about 13. So the total annual cost with a Plan N Medicare supplement, $1,279 versus the PPO Medicare Advantage plan with the free teeth cleanings, the free glasses, the over-the-counter bonus that you get that's like $30 every 3 months. Those are enticing, cherry on top benefits that try to get you in the Advantage plan, but the math doesn't lie. With an Advantage plan, you're going to pay $1,501 for one doctor's visit, an MRI, an overnight hospital stay for a knee replacement surgery, and 1 month, and let's face it, it's more than 1 month of physical therapy, but it's more than that for a knee replacement. $1,501 versus the Plan N, the total cost is $1,279. But I mean, I even have these really affluent, wealthy people in Hilton Head that are like, oh, I want the 0 premium. Well, first of all, we look at just a minor thing that could happen. What if you go to a dermatologist and you get something off your, zapped off your face or your back? You're looking at $300 outpatient surgery. That's outpatient surgery. Couple doctor's visits. But the true beauty of a Medicare supplement is, let's talk about the knee replacement. I had a lady a few months ago. She called me crying. She goes, my doctor said I desperately needed knee surgery. I had a blah, blah, blah Advantage plan. I'm not supposed to pinpoint or tell on these Advantage plans. But she had an Advantage plan. Her doctor prescribed a knee surgery. And the folks at the Medicare Advantage company said, nah, you don't need knee surgery. Our doctors think that you just need to lose some weight and do some physical therapy. And then we'll consider that 9 months down the road. You don't deal with that with an original Medicare and a supplement. Your doctor says you need the knee replacement. You get the knee replacement. Your doctor says you need an MRI. Original Medicare is going to pay that, and the supplement is going to pay the rest. So not only does the Plan N supplement beat the Advantage plan PPO in cost, but don't focus even on the cost. The point is you can get the care you need, where you need it, when you need it, and there are no denials or prior authorizations. Keep your eye on the ball. They're missing the whole point. If you have money, why would you risk turning over original Medicare, which you worked your whole life for, over to a private for-profit insurance company that's being investigated by the Justice Department, that's paid out hundreds of millions in settlements for improper denials, upcoding? Good luck if you have to go to skilled care getting that accepted. All right, I've had horror stories. I'm dealing with one right now. They just won't pay for skilled care. He's an 83-year-old elderly man, desperately needs to go to skilled care. His kids have to jump in. It's a nightmare. Advantage plans are great when you're healthy. So guys, January 1st to March 31st is an enrollment period. It's known as the Medicare Advantage Open Enrollment Period. Make a smart choice. don't get enticed, don't get lured into a low monthly premium and be short-sighted and give up your original Medicare rights, which is go to any doctor you want in the country that accepts Medicare, 98% of doctors. Don't give up your right to know that when you need surgery or an MRI or cancer treatment, don't throw that away and say, okay, private managed care company, Humana, WellCare, United Healthcare, CVS, Aetna, I want you to manage my care because I trust you. And I think you'll make the right decision for me, not my stockholders or my CEO. Reality is, guys, you got to take charge. With original Medicare, it's going to pay your claims. Whatever's left over by law, the supplement's got to pay the other 20%. All right. So teeth cleanings are great. Everybody needs clean teeth. Eyeglasses, $100 a year. That's pretty cool too. But when it comes down to, it's better. You find out you got some weird neurological disease. You got to get multiple tests done. With a Medicare supplement, you're going to get those tests done. You're not going to pay out of pocket. The supplement's going to pay the excess that this Medicare doesn't. With a Medicare Advantage plan, hey, I need to go to the Mayo Clinic. I got some weird disease. You can't go there with a Medicare Advantage plan, and it's getting worse and worse. All right? It's trending towards less and less doctors. We're going from a PPO to an HMO. Do you realize in our Beaufort, Jasper County, a lot of seniors retire here? There's really only one true PPO. All right. If you go out of network, your max out of pocket is $10,000 or more, but typically it's $10,000. So you can pay $10,000 when you get sick, or with a plan N for 70-year-old female, you can pay $1,300 a year. Your choice, guys. Make the right choice. Guys, the way to make the right choice is to download either the Apple or the Android app. You can put your phone up to this, download the app. And what that's going to do, you can go to your iPhone and type in May River Medicare, or you could just put your phone up there and scan it. It's going to take you to the only complete, transparent Apple app that's out there. You can type in your zip code, your tobacco status, your age, your gender, and your zip code, and you will get from lowest to highest. Let's say you're a 70-year-old female, like the example that we used, and you live in Hoosick Falls, New York, and your zip code is 12090, and you type in your name and your tobacco status. You're going to see lowest premium to highest premium, all the supplements for a 70-year-old non-tobacco. And we believe that the only way to make a smart decision is to know the facts. Too many people in the Hilton Head, Bluffton area go with Blue Cross Blue Shield or AARP. And then, they turn 74 and they're like, what happened? My premium's doubled since it did when I was 65. And there's $100 difference in a supplement that Chris recommended than what I have now. And they make a change from a plan N to a plan N or a G to a G. They don't change their coverage or benefits. They simply change the carrier. They save $100 a month. And this application was designed for you. You don't need to call me. You can get a supplement. You can look at the quotes. If you don't see value in what I do it on your own. But we're going to give you the actual, every company, what their rate is for your age, zip code, and tobacco status. All right? So you guys have a great day. And this is Chris Dewey with May River Medicare.